Okay, so we all hear HIV and AIDS used together, right? But what's the actual difference? When does one officially become the other? It's not some fuzzy line. It's a really specific medical moment. And that's exactly what we're going to unpack.
All right, first things first, let's nail down the absolute basics. HIV is the virus. Think of it as the intruder. AIDS, well, that's the syndrome that can happen at the very end stage of the infection. They are not the same thing. And this is super important. Someone with AIDS always has HIV, but, and this is the key, not everyone with HIV has AIDS. Getting that straight is like step one for everything else.
So if they're not the same, what is that trigger? What's the clinical tripwire that says, okay, this is no longer just an HIV infection, this is now an AIDS diagnosis?
So let's just ask the big question outright. What officially marks that transition? And just to be clear, we're not talking about how long you've had the virus or even how sick you might feel. Nope, this is all about cold, hard, measurable medical facts. And here's where it gets interesting. The answer isn't just one single thing. There are actually two different ways, two distinct paths that lead to an AIDS diagnosis. You can kind of think of it as the rule of two.
So the way it works is a doctor will make that diagnosis when just one of these two things happens. You don't need both. Hitting just one is enough. So ready? Let's break them down.
And here we have it. On one hand, you've got criterion 1 by the numbers. This is all about what's happening on a microscopic level, inside the immune system. And on the other hand, you have criterion 2 by infection. This one's about what's happening to the person's body as a whole when that immune system gets weak. So it's either about the lab numbers or it's about a very specific kind of sickness.
Okay, let's zoom in on that first path, the numbers game. It all boils down to a special kind of white blood cell, the CD4 T cell. A great way to think about these guys is like they're the quarterbacks of your immune system, calling all the plays. Now, in a healthy person, you're looking at a count of 500 or more. But as HIV does its damage, that number starts to fall. And when it drops below that critical threshold of 200, bam! That right there is an AIDS diagnosis.
All right, now let's talk about the second path. This one has nothing to do with lab numbers and everything to do with a specific kind of illness. We're talking about opportunistic infections. And honestly, the name says it all. These infections are literally waiting for an opportunity, for the body's defenses to be down, and then they strike.
So what exactly is an opportunistic infection? Well, think about it like this. It's an infection caused by some kind of germ, a virus, bacteria, you name it, that a healthy person's immune system would just swat away, no problem. But when HIV has really worn down the body's defenses, those same, usually harmless germs can cause devastating, even life-threatening diseases. Just seeing one of them pop up is proof of how seriously compromised the immune system has become.
Yeah, there's actually an official list of these so-called AIDS-defining conditions, and it includes some really serious stuff like pneumocystis pneumonia, often called PCP, Kaposi sarcoma, and really specific severe forms of meningitis or tuberculosis. And here's the rule. If someone with HIV gets diagnosed with any single one of these illnesses, that's it. That's an AIDS diagnosis. Full stop.
Okay, so now we know what does signal an AIDS diagnosis. But what's almost as important? Knowing what doesn't. There are a lot of misconceptions out there, so let's debunk a few of the most common ones.
All right, first up, you hear this one a lot. What about antibodies in the blood? I mean, if you've got antibodies, you're sick, right? So that must mean AIDS. Makes sense on the surface, but nope, that's not it.
And here's why that's wrong. The presence of those antibodies is actually how we test for HIV in the first place. That moment when your body starts making antibodies is called seroconversion, and it happens pretty early in the infection, usually within a few months. So yeah, it's a huge marker, but it's a marker for getting HIV, not for progressing to AIDS.
Okay, next one. How about symptoms, like a really bad fever that just won't go away? That's got to be a sign, doesn't it? Another no. Here's the thing. While a fever can definitely be a symptom of HIV, it's what doctors call nonspecific. That's just a fancy way of saying it could be caused by a million other things. The flu, a stomach bug, a common cold, you name it. It's like trying to identify a car just by saying it has 4 wheels. It's way too general to be a reliable clinical sign for an AIDS diagnosis.
Now this next one is a little counterintuitive, I'll admit. But could an increase in T cells actually be the trigger, like the immune system going haywire?
So this one is a bit tricky, but it's still incorrect. And here's the deal. Right after someone is first infected with HIV, in what's called the acute phase, the immune system can go into total panic mode.
It kicks into overdrive, which can cause a temporary spike in T cells while it tries to fight off this brand new invader. But that is the complete opposite of what defines AIDS. The absolute hallmark of AIDS is a severe, catastrophic drop in those critical CD4 T cells.
All right, let's wrap this up and bring it all home. If you remember only one thing from this whole explainer, make it this. This is the big clinical takeaway, the most important rule of all.
And here it is. A person with HIV who develops any of those AIDS-defining opportunistic infections is considered to have AIDS, regardless of their CD4 count. This is the trump card. It's the ultimate override. So even if their CD4 count is, say, 250, which is above the 200 threshold, if they get one of those specific illnesses, it still means an AIDS diagnosis. And why? Because that infection itself is the undeniable proof that the immune system is in deep trouble.
You know, understanding this whole clinical line is so important because it really highlights the most crucial point of all, which is that today, the story of HIV is completely different. Thanks to incredible modern treatments, antiretroviral therapy, people with HIV can keep their immune system strong, live long, healthy lives, and very often never progress to AIDS. It's turned what was once a death sentence into a manageable, chronic condition.
And that really leaves us with a huge, powerful question to think about, doesn't it? When you step back and look at it, how has this one single medical achievement, the ability to stop HIV from becoming AIDS, completely transformed public health across the entire globe in just a few decades? It's honestly one of the most incredible stories in the history of modern medicine. Thanks for joining me for this one.